Started in late 2005, this novel program created a framework for community-based chronic disease management involving general practitioners, community groups promoting healthcare, and the pharmaceutical industry.
In chronic disease management, we firmly believe that the patient is at the core of the program, and he must be supported by an important stakeholder, the most important of whom is his family physician. So what happens is we run training programs for the GPs on the full spectrum of care, and we also link them up with the Diabetic Society, where they can send their patients for eye screening, foot screening, dietary counseling. These are all very important to good management of diabetes. Then once the GPs are familiar and feel very confident about managing their patients well, then we accredit them as a JOT GP.
My role is to advise patients to the right place after they have been discharged by the doctor here. Because there are places where the patient can go to, whether polyclinics, .GP or GP. The .GP will send back the result of all the blood tests back to us, and we can follow them up for 1 year at least.
The benefits of the DOT program are really multifaceted. In terms of being a GP myself, I find that I really learned a lot from the refresher courses that were held before my certification as a JOT GP. That's for my personal benefit. In terms of my patients, I'm very happy that the DOT program allows them to access counselling services by the Diabetic Society of Singapore. From the patients that I have seen who participated in the DOT program, I find that they are definitely more motivated to take care of their diabetes and to prevent the complications of diabetes. Over the course of 6 months, they have definitely shown improvements in their diabetes and other chronic diseases control. I think the DOT program made me realize just how important other aspects of diabetes management is, which is, for example, the podiatrists as well as the nurse counselors, because diabetic management in terms of drugs alone is not enough, and that we need to work together as a team to help the patient towards better management of diabetes and reducing their complications.
With the help of our partners, we have recruited a group of committed GPs in the community dedicated to the care of patients suffering from chronic diseases. As part of joining the network, these GPs have enrolled their own diabetic patients in a program that has involved counseling for patients and their families. These sessions are provided by the Diabetic Society of Singapore and sponsored by Johnson & Johnson Medical Singapore. As part of the new DOT, patients will also have access to an expanded network of ancillary care providers, such as the NHG Care Management Centres. We will continuously strive to increase the level of care for our patients.
We have lots of patients with chronic diseases such as diabetes, high blood pressure, dyslipidemia, chronic obstructive airway disease, and bronchial asthma, etc. And our GPs are in a unique position because they know the patients and have long-lasting relationships with our patients and the families. So they have a big part to play in improving the care of these patients, and you'll probably find it extremely rewarding to come forward and provide care to these patients and improve their condition as well as reduce complication rates in the long term. One of the major advantages of us coming together and working together on this program means that we now have an extended network of committed GPs who can give structured and continuing care in a holistic fashion to our group of patients with chronic diseases.
The new national DOT program looks to build on its past successes to grow our network, increase the number of services available and chronic diseases addressed, to offer more choices to the patient and provide better care. You can contribute to these goals. Participate. Be part of the new DOT.